Yeah.
So many disappointed people.
I know. Just give it a minute and then. Right, well, it's bang on 2 o'clock, so we'll start. Welcome, everybody. Thanks for coming online. And sorry to all those disappointed viewers out there, but hey ho. So welcome to the Health and Wellbeing Board SEND subcommittee. I think we all know one another and we all know the rules for these meetings by now. So we'll get straight on with. Yes.
Brilliant. And we do have Sarah Gorse joining us for the first time today, who's the SEND Partnership Manager.
Hi, Sarah.
Hello, Sarah. Hello, Sarah. Sorry, I mean, you weren't popping up. You are now because you've spoken, but you weren't popping up on my screen. Okay, well, welcome. Welcome. Okay, so we're all here. Apologies. We've got Debbie Corcoran has sent her apologies. She's had to go to another urgent meeting, but we are quorate and we're ready to go. So minutes of the last meeting. Has anybody got any comments on those? No.
Chair, I think I have some.
Oh, right. Okay.
Just bear with me a second.
It's all right. I can see.
I try and flick through. Bear with me. Yeah, it was just an acronym issue on page 3. Second bullet point down.
Oh, yes.
Where it says current policy arrangements in each integrated personal commissioning, and then it says ICP. Now, unfortunately, in the world I live in, there are so many acronyms. ICP to me means Integrated Care Partnership, and if it was meant to be Integrated Personal Commissioning, it probably would be IPC, so I'm completely baffled which one it is.
Right. Perhaps someone can clarify that, but I think it probably ought to be IPC. Zoe, is that right?
I think so. I haven't got the minutes open in front of me.
Yeah, I think it should be IPC.
I think it
well,
is.
I'm happy if even that's a likely suggestion because it clears it up nicely.
Okay.
Craig and I will make sure that we've clarified that before they're published. But thank you for that.
Okay,
yeah,
thanks, Zoe.
It's strange, isn't it? As soon as you said it, I knew immediately. It's really weird, and I've read those twice already. So there you go.
Hiding in plain sight.
Yeah, that's right. Okay, so we now move on to item 4, which I think is, I'm not sure who's leading on this presentation to take us through the accelerated plan and to also give us an update on situation ready for the visit.
Yeah, I'm going to start, Philippa, and then pass on to Zoe to take us through the APPs, the accelerated progress plans. So.
Okay. Great, thank you.
Are you able, is everybody able to see the presentation that Craig's put up on the screen?
Yes.
Oh, good.
No.
Well, that's a good.
Oh, right, hang on. Kevin can't see.
I can see the fact that the screen has now changed shape, but it's black where I would expect the presentation to be. Has anybody else got that issue, or is it just me?
No, I've got like a black and white slide that's up.
Right, I haven't, so I don't know. Right. I can't see an I'm that's not pressed.
No.
So.
Okay. Sorry.
I was going to say what I can do is perhaps just try and quickly load it on my iPad, see if that's different.
And Kevin, I can just quickly email you this presentation as well, so that you've got a copy in front of you.
That'd be great. Thank you, Zoe. Perfect. Oh, it's now. Do you know it's appeared as soon as you said it?
Great. Your system must just be a little bit slower, I think. That's
yeah, good. I think mine's steam driven, Sarah.
Okay. Well, hopefully I won't freeze in an unflattering pose.
No, hope not.
As I go through this, but that's what tends to happen. But what we thought would be really helpful is I know that members had said at the last meeting that it would be useful to have some more detail on the data that we use to shape our response in the accelerated progress plans. So what this presentation is aiming to do is share some of the data that we use, but also the process, because obviously data is just a starting point, isn't it? And you have to check, is this data an accurate reflection of the experience of children and young people? So it's a short presentation, but it aims to give you an understanding of how we use data, and share with you some of the data, but also the process. So if we move on to the next slide, please, Craig, that'd be great. And I'm going to wait so can everybody now see a different slide?
Yes.
Yes, thank you.
Oh, brilliant. So what this slide does is give you a sense of how many children and young people across Lancashire have special educational needs as a percentage of those children that attend school. So you can see on the top right, it says 176,456 total pupils at all schools. And then of that number, there's 17,705 who have SEND support. And then a little bit further down, you can see that there's 8,000, and this is a test of my eyesight, 8,085 that have education, health and care plans. So, and of that total, there's 3,138 that are in our special schools. The reason I'm pointing that out is that typically in Lancashire, the percentage of children with education, health and care plans hovers around 3.4%, which is in line with national. But what is different to national, and this is why it's important, our use and application of data, is that that number in special schools is higher. So the aspirations of the SEND reforms that were introduced in 2014 was to enable a higher number of children with special educational needs to stay in mainstream schools, because this is better for them in terms of their ability to develop those life skills that enable them to be more independent. But it's also more cost effective as a council, you know, because for some of that more specialist provision, it's obviously more expensive. So our drive is about supporting the best outcomes. So to enable more of those children with special educational needs to stay in mainstream provision where appropriate, because it absolutely isn't appropriate for all young people, then that's what we want to do. So as you work your way around, you can also see that we understand that 62 children with special educational needs are electively home educated. So that's where parents, carers have made the decision to educate young people at home. We have 1,700 electively home educated children and young people in Lancashire. That obviously is a fluid number, it changes. And 62 have educational, health and care plans. So it's a fairly small percentage, but obviously we would have, it's another vulnerability. So we would want to have oversight of those children with special educational needs. I'm not going to pull out all of these figures, but what it's attempting to do is to show you that there's all sorts of data that we are aware of, and that helps us to have a better understanding of the experience of children and young people in Lancashire. And it's in comparing that data with national and with our statistical neighbours that we can identify, well, is there something a bit odd there? So our ambition isn't to be in line with national, but where we're at odds, it does prompt a discussion. And as we go through these slides, I can point out a couple of other things that have helped us to have that better understanding. And obviously the reason I'm sharing them today is one of the areas in that's subject to ongoing monitoring is that leaders have an inaccurate view of the experience of children and young people with SEND in Lancashire. So the application of data is really critical to us all having a better understanding. So if we go on to the next slide, please, Craig. So what this slide does then is it breaks down, there's some overarching needs within the education, health and care plans, and these are those overarching needs. So we've got, there's a blue bar and there's an orange bar. The blue bar is Lancashire and the orange bar is national. So in the first one, it's cognition and learning. So you can see that national is slightly lower than Lancashire. Then we go on to social, emotional and mental health. And you can see that Lancashire again is slightly lower than national. What's interesting here is that this is about mainstream primary and secondary schools. So if you think back to what I've said about the previous slide and the fact that a larger number of children and young people in Lancashire with SEN are in special schools, you could look at this slide and think, well, we look broadly in line with national, so we don't have to be overly concerned with this information. Actually, when we look at the numbers of children in our alternative provision, our PRUs, our pupil referral units, and our special schools, it's the level of children with a social, emotional and mental health is actually quite high. So it's about how we use the data. So similarly, if you go across to the communication and interaction, we can see that nationally there is a broader, a higher identification of communication and interaction. And again, data is a starting point for our analysis, isn't it? And communication and language, we know if we don't identify that early on, it's those issues that then manifest themselves in disruptive behaviour because young people get frustrated because they're not getting their needs met. That then ends up in exclusions and it can ultimately end up in criminality. So this is why this data is a starting point for discussion, but then we have to think about, well, what could it be telling us? So this could be telling us that our ability to identify communication and language is could be, you know, we could be doing more of that, or we could be sharing those developmental delays in that integrated pathway from 0 to 5, so that we're picking up these needs, meeting these needs, they don't escalate, and then we have better outcomes for children because we don't see them, children with SEN, represented in our exclusion data. So it's what I'm hoping that you're getting from this is that we're using our data to prompt discussion, but it also has to be considered not only against national and stat comparators, but also in terms of, well, how does this relate to the data overlapped with what's coming through health? How does it relate to what we also understand in terms of the prevalence of needs in our non-mainstream provision, so in our alternative provision and our independent provision? So if we go on to the next slide then, Craig, please.
That's showing up okay.
Oh, thank you. Sorry, I'm a bit of a delayed response there. Sorry, because I'm so blind, I'm having to read it on my separate presentation. So thanks for telling me that. So what this next slide then does is it kind of illustrates what I was saying about, we get the, so on the top left-hand corner, we get the soft and hard data. So soft data might be case studies about a young person's experience through our education system. And then we also get our hard data, so some of that I've just shared with you. And it's a combination of these things that then we analyse, and it helps us to understand and then inform what we're doing. And that leads us to map and review and help us identify which deep dives we might want to do. So for instance, looking at the data I've just shared, we might want to do a deep dive on communication and language. You know, we might want to look at the trend over time. So what I've shared with you today is just our as is position in terms of the level of needs, but we also look at the trend over time, so the last 3 years in comparison with national and statistical neighbours, and that helps us again to think, well, would we want to do a deep dive on speech and language, or is this just a bump, you know, and actually it's just a one-off year group? which has particular needs, so it's not necessarily identifying a trend. Having done that analysis, that helps us then to, I suppose, shape our commissioning and how we co-produce and co-design the support to children and young people. So, for instance, again, using the example of speech and language, you know, our commission with our speech and language therapy services should be informed by that data. And that should then shape improved outcomes. So it's a continual cycle of understanding data, testing that data with some of the qualitative case studies and the soft intelligence that we're getting from our schools and from our parents and carers. And then that all of those things combined help shape how we commission the right support to meet the needs that we understand within the across the county, and those needs are going to be very different in different areas, and that's part of that analysis that makes allowances or responds to those very different needs, because we know that a child attending school in Burnley, for instance, is going to have a very different experience from a child attending school in the Ribble Valley, so we can't have a one-size-fits-all approach. So if we move on to the next slide, Zoe's going to now talk through how we apply this and how it makes sense in terms of the accelerated progress plans. Thanks, Zoe.
Thank you, Sarah. So we thought it would be helpful if we went for practice in action here and showed you how we now turn all of that into information that informs us through the performance monitoring process. So obviously, ordinarily, I take you through the 5 highlight reports. You've received those, and I'm not stopping you from asking questions on those when we've taken you through this, but we thought this was a more helpful way of demonstrating that rounded narrative of the way in which we have the data flowing. So this is a diagram that we're using to help us see how we're doing in relation to the accelerated progress plan. We had specific actions that we had to take by December, and then by the end of March, and then again July and September. And this is helping to show where we are at with that. So let's start off on the right hand side with those 5 scrolls in blue, and those are telling us documents that we've got. So we know we've got 1 accelerated progress plan. We have 1 revised ASD pathway definition, which is now being adopted. We have 1 reviewed and revised joint commissioning framework, which is now approved and is being used. We have 1 developing co-produced SEND plan. We're at the early stages of that, but we thought that was worth including because it is something that we're working on at the moment. And it also informs how we will carry on the work beyond the accelerated progress plan. And then you'll see underneath that, as of the 9th of March, we now have an approved ICS bowel and bladder framework. So in the accelerated progress plan, you'll see this referenced as continence. And what we discovered through that work, that actually it needs to be called a bowel and bladder framework. So those are 5 documents that we now have in place through the duration of the work we've done to date in the first 6 months of the accelerated progress plan. Moving over onto the left-hand side. I do normally know my lefts and rights. So over at the top left, we've got 96% of leaders who scored 100% in the SEND board quiz. Now that's above the target we set ourselves for December. We've done another quiz since, and we're just in the process of analysing that. But at the time of this document going out, we only had the results for 1 of those because, of course, we're not quite at the end of March yet. But early results are showing that we will be up there again above targets for the leaders scoring well on the SEND board quiz. The 3 that are in a pinky red colour, this relates to the local offer. So we have the first one, £20,000. So the NHSE gave us funding to support us strengthening the health input to the local offer through co-production, and that work starts pretty much immediately now. It's about to start in terms of working with families around the work that we need to do for the health input. That will support the next one along, which is One Local Offer social media awareness campaign. And Sam Jones, who's the chair of the Lancashire Parent Carer Forum, has been a key player in this piece of work. And the survey that she shared with families has resulted with a pretty high response rate very, very quickly. We got over 90 responses in about 5 days. And the quality of the information on those pieces of feedback as well has been really high. And yet we expected to have very little engagement, and we didn't expect there to be a high level of quality. So we've been pleasantly surprised. Obviously, a lot of that is telling us what we're not doing well, but through telling us what we're not doing well, it tells us what we've got to do. And that ties in nicely with that £20,000 we've had to support the health input onto the local offer. Those people who are using the local offer, 59% of people who filled in the survey on the local offer have told us that being on the website, they actually do find the information and they find that they're looking for, and they find it useful to their needs as well. We do have a greater need to improve the crumbs, I think they call them in web design ways, but you know, the little things that help you to go back a page and make it so that once you've found that information that was useful, you can go on to find other things as well. So that's a next piece of work. The orange ones on the left hand side are about the workforce development. So you'll see at the bottom we now have one draft workforce development strategy. That's something that was overhanging from our previous improvement plan that needed to have immediate attention. And we also see that that's something that's crucial to the work that Sarah Callahan is leading on, in ensuring that our leaders have a good, strong understanding of the local area. And so as part of that, I've been going around visiting various virtual team meetings, and the number is actually higher than 244 now, but we were at 244 people who had attended to date on the Send is Everyone's Business briefing. And the impact that we've got out of that, one commissioner got in touch with me and said, you couldn't have timed that better and you couldn't have presented better information, because I had a paper going to the execs about transitions in healthcare, and it went through straight away because all the execs knew and understood the importance of that. We've also had other people who have got in touch saying, I now understand how important Send is. Can you also come along and visit? So we've got integrated care system groups that want me to go and visit and do the presentation there. We've got providers who've asked for it. We've got informal networks that have asked for it. So as a result of the presentations to date, more people are asking for that. So it's landing well and helping people to understand how Send really is everyone's business. And then the next one, the circle saying 3 staff on Send leadership programme. Now, OK, I'll be honest, we're borrowing one person there. So Alison May from Morecambe Bay CCG attended on behalf of Cumbria. But we figure that as she's also based in Morecambe Bay CCG, that we can claim her as one of our own, because she is in Lancashire as well, and we are benefiting from her joined up thinking approach. We also have Sally Richardson, Head of Inclusion, and Anne Hardman, who's one of the designated clinical officers, who've also been on the Send leadership programme. And they've all said how valuable that has been, and there's a lot of learning come from it that is now starting to be implemented in work that's going on within Lancashire. The 3 that are teal coloured, tealy green, I'm not quite sure what colour that is, but let's call it teal. They relate to transitions in healthcare. Now, yay go us that the local area knew that we would only have 20% of people say that the experience of transitions was good or very good. It's a disappointing number, but the fact that we said that that would be our baseline is at least indicative of the fact that we know the local area. It isn't good. But also the work that we've done then with our providers, they've got in touch saying, do you know, we're not sure that's an accurate picture, because we get the verbal feedback from those who have the transition conversations and start work on a transition plan, telling us that it's been a very good experience. So from the 1st of April, we've got a new survey approach. It will identify which provider, and the providers will be encouraged to pass that survey on when somebody has had a transitions appointment. We're also, if I link that back up to the £20,000 for the funding from NHSEI to support the strengthening of the health input to the local offer, whilst it's all being done through co-production, one of the pieces of work we've identified we'd like to do, and parents have told us they like this idea, is that we'll create a 90-second video for practitioners so that it's on the local offer, but so that families can watch it. And that empowers them so that then they can go to appointments and say, hang on, my child's 16 and you've not yet had a conversation. So it empowers them to be part of that. And they're feeding back to us that when it comes to transitions, they want to get to the place where they're annoyed at the number of people who have the conversation rather than waiting for somebody to have the conversation. So we fed that back to our clinicians, and they're going to start having those conversations, even though they're not sure at the moment that they should be the person doing it. So we have a position where all providers have agreed the transition model and the transition pathways. We do have some work to do in terms of bringing primary care on board with that, because one of the pathways does relate to them. And then we have 30% of our 14-year-olds and older telling us that they have a transition plan. Now, last week at the task and finish group we had for this, I have to tell you, it was an amazing meeting. We had young people come and join us, and they explained to us how important it is for them to have the transition plan. And they outlined some of the problems around those who are in residential care automatically have a plan, automatically have an annual health check, but it's actually up to the young person to request that if they're not in residential care. So they gave us a lot of pieces of information such as that, about understanding about what would help them to meet their needs around transitions. That was really powerful. And they've recorded the attendance at the meeting so that they can share it themselves, but they've asked us to share it as well with a lot of other people. So we're going to look at getting that up onto local offers. We have 100%, so one of our targets was to have all schools to know the name of their public health school nurse. So that's now up on the portal. All schools have also had a presentation sent to them, and I understand that Karen Gosling has either just attended or is about to attend a head teachers meeting to talk them through this fact that they've now got their named public health school nurse. One of the things we need to keep aware of there is that that doesn't necessarily satisfy schools, as everybody would like to have their own public health school nurse, but because of numbers, it's not always viable to do it that way. And so we then therefore have made the approach down the route of having a named public health school nurse. In terms of the greens, so the greens all relate to ASD. And I think this is a really good example from the information that Sarah shared with you before of how the approach that we use for data flow is proving to be incredibly powerful for us. So first of all, just to take you through, so we know that we've now improved things with the waiting list, but we haven't improved them to the point of reaching zero in every area. And we do know that it is going to be difficult to do that because there are continuing increasing numbers of children and young people who are referred onto the waiting lists. But we do have 3 funded ASD, autism spectrum disorder, waiting list initiatives. I'm trying not to do the line of duty thing from last night where I had to go and Google everything. So I am trying to remember to tell you all of the initials when we've got them on here. So ASD is autism spectrum disorder. So we have 3 of those now funded across the area. 50% of those who have gone through the process and had ASD support throughout the pathway tell us that they are happy with that support. We do know that there is more work we've got to do on that. And again, I mentioned Sam Jones, the chair of the Parent Carer Forum earlier on. She is actually supporting us in doing this work to make sure that the work that's done for Within Health is really matching what parents want. And that includes things like the name that a support offer might be given. So in the past, a support offer might have been called parenting skills, and parents have told us they're insulted by that. And I can understand that feedback. So we're taking that feedback from them and trying to work through improving Within Health. But I'll come back to support in a moment. 80% are telling us that they're happy with the assessment and with the outcome. And 100% have had a first contact. It's not all been by letter. We did state in the Accelerated Progress Plan by letter. It's been, for some it's been by letter, for all it's been by email, and also where people haven't responded, it's also been by phone. There are some people who've not responded to any type of contact, but we know that 100% have been contacted. And 100% of people have had their first clinic appointment within 4 weeks. Fylde Coast is an example, though, of where we need to be addressing moving back to the neurodevelopmental pathway. Fylde Coast is the area that's piloted this for the whole ICS, integrated care system, and they have demonstrated that having this as a whole approach with all the areas of neurodevelopmental pathway, which includes speech and language, includes ADHD, It's been a much more positive approach and has helped to ensure that people don't get trapped in a revolving door. So where they don't get an ASD diagnosis, they might have to go onto a new referral. With the neurodevelopmental pathway, it means that they stay in the pathway and they receive the range of assessments that are appropriate to them. And you'll see there that they have 0 awaiting an ASD triage. And in fact, they only have 5 who are awaiting their first clinic appointment, which are just those people who've come onto the waiting list in the last month. So they are actually finding that that's working incredibly well. Their one area of issue is related to speech and language therapy, and that's a piece of work, a project has just been approved for them to undertake a piece of work on the Fylde coast that is looking at the review of speech and language therapies. So I said I'd come back to the support offer, and this is an example of where the whole system working together is proving to be very powerful. So we heard that there was a piece of work being done within the council to deliver some training to the Senkos. And so I got in touch with the person who is delivering that, and the work that person's doing, which is Amira, I think you say her name, Helm or Helme. She is a specialist teaching, she's in the specialist teaching unit. I think that's the right title. Sarah will be able to correct me if I've got that wrong. And she is delivering training to the new Senko network, which has 500 schools subscribed to it currently, and that's an increasing number. And she's providing training on ASD referrals to help people understand the support mechanisms that can be adopted prior to referring somebody onto a health model approach. And so this is making sure that we're joined up in the work we're doing. So then support starts at the point of need rather than support starting when somebody is on the health model and getting support through health. So that's something that's really powerful. And I think we will see that number of 50% increasing once we've got support happening at the first point of need rather than later down the journey through the pathway. So then the last thing, one of the things we said we would show is the percentage of people who are satisfied with the level of support they get from different services. What we've found is that although a lot of surveys and questionnaires go out to people, very few come back in. Some of those are because they are perhaps too late after. So we're looking at things like if it's sent out too late, and so people perhaps need it at the time of accessing the support that they get. Some it's because we can't identify which are send because it's to all children using a service. And some we don't know why they're not responding, but we're just getting very few responses. But we do know that for the SendIAS service, for the SendIAS team, they have 79% of people who are saying that they get supported by SendIAS. And I think they had somewhere around about 25% return rate on their surveys. Now they said, oh, we only got a low return rate. And I was going, no, that's actually really good. We're really pleased to see that there's that high level of return rate. So we do know that 79% comes from around about 25% return rate. So that's where we're at with our KPIs, our key performance indicators. But I thought you'd also finally like to see, no, I was trying to move on the slide, but of course it's Craig who needs to move me on. So this final slide shows you where we're at in terms of the actions that we said we would deliver on within the accelerated progress plan. So you'll see that the blue is that we've completed, the green is that we're on target to complete, the yellow is that we're delivering on something but we're behind target, and the red is where we're delivering with significant delays. You'll see that the delays relate to the transitions in healthcare, so that's action 4, and number 5, which is the local offer. I just want to start at number 5. Oh, by the way, this is current position as of last week, because we've got the monitoring meeting this week with Department for Education and NHS England. And so this is our current position as at now. And action 5 was actually previously pretty much all red, and that relied on the fact that we didn't have Anna Birkinshaw in post. She started with us on the 4th of January. Not only has she done her induction, but she's also really brought this action on at pace. And I think that's something that she should be congratulated for, that she's really got to grips with what we needed to happen and has delivered significant amount of work and has plans in place now for significant work on the final actions. So we're really pleased to see how having somebody in post has made that difference. we did have somebody who was interim supporting that work, but unfortunately went on long-term sick, and so that impacted on the delivery as a result. In terms of the transitions, the red relates to the engagement of our adult services and the data, and that is impacted by COVID. But we also now have a remit from the Collaborative Commissioning Board, having done an update to them 9th of March, that I'm to now go and visit each of the cells that we have in place, the in-hospital cell, out-of-hospital cell, and the mental health cell, to talk them through transitions and the importance of the adult services being responsible for receiving young people into their services, as opposed to the other way around. And that is then to be escalated to the Collaborative Commissioning Board on a regular basis if the adult services continue not to engage. Otherwise, on that one, we are delivering to target. So that shows you that at the halfway point, we are more than halfway on with our actions. We're also nearly a quarter of the way on target to completing other actions, and we have plans in place to make sure that we are able to achieve those that are delivering behind target or delivering with delays.
Okay.
Thank you.
Yeah, thank you, Zoe. Are we keeping these slides up, or is Craig going to take them down?
It's probably easier if you took them down.
Yeah.
Craig.
That's great. I mean, actually, I don't know how the others felt, but I felt it was helpful to look at it in a different way than just looking at those pages. It was sort of kind of brought it to life a bit. So I'll just go to anybody else first, see if anyone's got any questions they want to raise. Any points?
Yeah, just a couple of points, Chair, if I may.
Yes.
I was feverishly looking for my yellow hand to put up, but I couldn't spot it in time. I agree entirely, Chair. I thought that was very refreshing. We have had a chance to read through the Accelerated Progress Plan, which as ever, Zoe, is very detailed and succinct, which is very difficult to achieve, I think, with so much information. For this committee's purpose, that last slide was extremely useful, because I think that's what we're about here, is to help you ensure that these things get delivered. But a quick question on the last slide, where it says deliverables on the y-axis, what are they? Are they on the Accelerated Progress Plan as something? Because I noticed the numeric.
So if you were to return to the original document that we submitted to the Department for Education back in September, that under each action has a number of tasks that we will deliver on. And so I've counted up each of those tasks. We have tasks within tasks, actions, if you like, within tasks that we've been delivering on. So we can't do some of our tasks without doing other things first. But I've taken the core number of actions that we said that we would deliver on, and made sure that we are reflecting where we're at with each of those. One of the things that I think is really difficult with this, Kevin, is that, of course, as we're doing this work, we're improving all the time, and we're perhaps making things more difficult for ourselves at times, because we add in extra tasks that help us do things even better. So I think that, this is very useful. I've certainly found this very useful, having these scrutiny events and having the monitoring that we've got this week with the Department for Education and NHSE, because it really does help to focus our minds on, are we doing as well as we can? So that deliverables is the number of actions, but it doesn't demonstrate the broader range of actions and tasks that we deliver on to make sure we continue to improve.
And if we wanted to dig deeper into the ones that are still in red, we'd need you at the minute to translate what those actions are. We can't read it across ourselves anyway, can we?
Well, that would be where the highlight report then becomes the tool in which we're able to understand the areas of delay. As I say, that's the position as of last week, because we knew that we were creating that slide for the monitoring meeting, and we thought you would find it useful to have that as well. So it's more updated than your last version of the highlight report.
Okay, and you would highlight to us any of those areas that are sort of sticking, if you feel we as members of this committee can help you.
Yes, and I mean, last time round, I think it was the last meeting,
Yeah.
one of you asked the question around transitions and the fact that it was appearing yet again.
Yeah.
And that was why I raised that with the Collaborative Commissioning Board, so
Yeah.
that, in fact, Hilary would have raised it. I should say that Hilary was on annual leave, so I went on her behalf.
Yeah.
And so I raised that in that meeting, and it was really useful how even just mentioning that immediately got traction with the Collaborative Commissioning Board, with an approach that we can actually manage and get some engagement and from senior executives within the hospitals, as well as the bottom-up approach that we're already adopting.
That's great. And you'd feel comfortable enough telling us if you thought there were areas that we needed to do more to try and assist you, you'd let us know.
Absolutely, yes, very much so. And I do value that support, actually.
Thank you. Speak.
Okay, thank you.
Thank you. Thanks, Chair.
Okay, Sean, have you got anything you want to ask, or are you okay?
No, I'm okay. I too like that, the way it's set up now. There, it's a quick, like Philip has described it, as bringing it to life, which is good. I just maybe a bit of a concern about, like you say, the lack of response. Do we have, to people on their initial contact? It was the second to last slide, I think.
Yes, in relation to ASD, that there were this.
Yeah.
Have
we an understanding of why?
Yeah.
Why that is, and what happens to them? Do we eventually give up with them, or are they picked up some other way?
Unfortunately, we do have to eventually give up if people. It's just like if you had a hospital appointment and you didn't turn up for your hospital appointment, or you didn't respond to an invitation to book an appointment. There comes a point where the hospital can't force you to attend. But what we do know is that there has been a tendency. This is a tendency that we're in the process of changing at the moment. But in the past, there's been a tendency for people to talk in terms of the length of wait for an ASD diagnosis. So a wait, and this doesn't happen. I've worked in hospital trusts with waiting list initiatives and working on how you understand a waiting list initiative. There's no other waiting list I'm aware of that refers to a wait as being from the initial point of referral through to the point of diagnosis. So it's usually referral to your first clinic appointment. Our families, though, quite rightly to them, when they first hear the mention of ASD or autism, they will actually consider it as being, that's the first mention of it, therefore that's the start of the wait. And they consider the end of the wait as being the point of diagnosis. As a result, when families talk to each other, and other professionals have got into the habit of this language as well, unfortunately, they will reference the fact that it's a long wait for ASD. It's not a long wait for ASD. There are some people for whom it is required for them to have a long wait, to do with the complexities, to do with comorbidities, which is more than one condition that might impact on each other, and also because of the age of the child. So there are times where it is required to wait until it's the right time to be carrying out a specific assessment. As a result, so this comes back now to your question, as a result, it means that people use the language of, well, you might as well get a referral just in case. Well, tell you what, why don't you put yourself on the waiting list? Because you could be waiting a long time. So there are those who it's not actually relevant for them to be on the waiting list. So they are self-removing effectively by not responding. Now, that doesn't mean, and this is really important for the work we do as a whole system together going forward, it doesn't mean that there isn't a need there that needs to be addressed. And so the work we're doing, and I mentioned Amira Helmi earlier on, so the work she's doing with the SENCOs through the SENCO network, and linking in with the work that we're doing on the whole pathway for autism spectrum disorder, is to help ensure that there are support offers in place from when a need is first identified. And that means there are some people who will never need to be referred onto an ASD waiting list. And then we shouldn't see people just dropping down. So we have a problem in terms of the ratio from referral to diagnosis. A lot of areas it's very high. So the number of referrals is very close to the number of diagnoses. We have a lower level of that. So we've got a lot of referrals and not so many diagnoses. And that's the thing that we'll turn around by having what's called a graduated response in a pre-referral period that will help us to make sure that people get what's required for their needs at the point of the need being identified.
Thank you. Very comprehensive. Thank you.
Yeah, that's helpful. Thank you. But it's interesting, isn't it? How it's so different to everything else. I hadn't twigged that, but there you go. Can I ask you about the actual sort of presentation and that this upcoming event with the DFE and the NHSE and how it will actually what's going to happen and when will we get the outcome from it? And what are we hoping from it? I suppose is the sort of the ultimate question. I don't know who's going to take that, Zoe or Sarah or Hilary.
I'm happy to. It's probably more appropriate from Hilary or Sarah. I think.
Go on.
Shall I go first as far
Yeah.
as
Start, I'll chip in, yeah.
So the 6 monthly review is on Wednesday.
Yeah.
And there are a number of people coming from the DFE, and I think one person from NHS England is attending that. So that'll give you a bit of an idea as to the balance, perhaps. We will. We've been invited to give a 20-minute presentation of where we are, and some of what you've seen today, plus the highlight report will cover that, and then we are expecting to get a number of questions from them in each of the categories for them to tease out where they think we've got to in terms of achieving the accelerated plan. In terms of what happens next, this of course is a 6 month review for them to check that they think that we're on course, and we'll have another review at the end of the year period to make sure that we've achieved what we're supposed to. We have been having 6 weekly updates with them, but I don't think that those are supposed to continue after the 6 months review. But I guess there'll be some discussion about that, because I can't imagine actually that they will not want to continue to keep a check, not because they don't think we're progressing, I hope, but just because they'll want to continue to do that. So what I'm expecting is that they will give us some idea as part of the meeting as to how they think we're doing. We've had to provide, rather Zoe and Sarah have had to provide an awful lot of information to them over the last few weeks, so they will have had a chance to read that. So hopefully they'll give us some indication of where they think we're going, and then I expect we'll get some sort of formal communication from them as well over the next few weeks. Sarah, do you want to add anything to that?
I was just going to add that we had actually an updated agenda today that landed.
Yes.
And I guess the key thing is that the focus is very much on those areas in the accelerated progress plans, and we want to keep the focus on those areas, but they have also asked for any innovative practice that we've developed in response to COVID. So that will give us an opportunity, I think, to share some of the genuinely good practice, because although COVID has been obviously a massive challenge, I do think we've all recognised that our partnership working has really strengthened during COVID. So it will also create that opportunity to say, and here's some really positive things that we've developed as a partnership as a result of COVID that obviously relate to the areas in the accelerated progress plans.
Yeah, I think that's right. It's a sort of a bit of a balancing job, because we really want them to recognise the extent of the progress on the 5 key actions, don't we? So we can close those down sooner rather than later. But at the same time, make it clear to them that it's, we don't see that as job done. So that's the issue. The problem is if you spark their interest too much, they keep coming back forever. Which we really wouldn't want, but similarly, we don't want them to think that we've just gone through it to sort of finish it off and be done with it and then gone. We want it to be a sort of lasting thing. So yeah, a bit tricky one. But do you feel that we've got enough to show that journey though in terms of progress?
Yes,
yeah, definitely.
Okay.
Yeah, I think some of the processes that Zoe and Sarah have developed, just that that little data flow. It's some of the processes that have strengthened, I think we're really confident about. So in terms of how we've all collaborated, I think we can really show some shift, can't we? So yeah, hopefully we'll have some good news to share with you at our next meeting of this group.
Yeah, well, I was hoping that we might get to know before then, actually, because the next one's not till the 21st of June.
We also want to demonstrate to them that we know that we will have more work to do, but without calling it an improvement plan. There will be some improvements, there will be some delivery, there'll be some monitoring. So we're demonstrating to them as well that we are working on the development of a SEND plan for 2021 to 25, and that will help us to show that there will be other work that we know that we've got to carry on with. So hopefully that will help them to see that they have got confidence in our abilities to deliver without feeling the need to carry on monitoring us.
Yeah. Well, I mean, I don't know what the timing is for the outcome of it, but I'm sure members of this board would like to know broadly. So if someone can let us know how it's gone, that would be helpful.
Yeah. I've just written in the chat, we'll make sure that you do.
Oh, thank you. That's good. Thank you so much. Brilliant. Okay. Anything else from Kevin, Sean, that you want to ask?
No, I think, like I say, the information that's come through today, I think, is really useful. I think you say we're nearly 6 months in now, or thereabout 6 months.
Yeah,
we are 6 months now.
Yeah, and I suppose what I'm starting to do now is go back to the very beginning of the accelerated progress plan, where you've got your what I'm presuming are your proposed outcomes, the 1 to 5s, and if they are the aims to be the outcomes of this programme, is to start to think about, are we going to be in a position to be able to say that they're being achieved, or probably more to the point, are we thinking about how do we measure those, or what it is that we look to do to measure those? Because what I'm seeing at the moment is an awful lot of inputs and outputs, and a lot of action, a lot of activity. But those broader aims, those broader outcomes, when do we get to the point, or when we do get to the 12-month point, can we reflect that they're being achieved? So it's just food for thought, Zoe, rather than
one of the things we've identified through the work we've been doing to do exactly that, is that it's really clear that the people who have a satisfactory outcome are less likely to let us know their experience.
Yeah.
So that means that we are stuck in a position where we are more likely to hear from those who've had a negative experience. So we are looking to see, well, what other ways can we capture feedback from people so that we can capture some of that positive experience, but also looking at those other ways that we can look at having effectively an impact measure that isn't necessarily about people's opinions of their experience. So, for example, if we demonstrate that somebody's voice is heard, which is one of the national potential measures that we could use, we would look at that through the fact that a young person was involved in the review of their education healthcare plan. And so if we've got a higher percentage of children, young people involved in that process, then their voice is heard. But they might fill in a survey saying, oh no, my voice isn't heard, because it's only those few who didn't feel heard.
Yeah, this is a difficult one, but at least I think you've got that right position now to be thinking that way, which I think is really important. So yeah, thank you very much, Chair. That's
good. That's fine. Okay, right. Well, I think we've covered everything there. So well done, and thank you very much for that. And good luck. Is it tomorrow, or what day is it today? It's Monday, Wednesday. You're doing it, aren't you? We'll be thinking of you.
Thank you.
Yeah, and so in terms of the recommendations from this board, we've noted the progress, we've given some input and questions on there, and thank you very much for all of that. So urgent business, which is item 5 on the agenda, we haven't got any, and the next scheduled meeting of this subcommittee is the 21st of June, if you can believe that, but it seems ages ago away. But the meeting will be taking place, obviously, because of the elections. There's a bit of a gap, and there isn't, at the moment, there's only provision for the meetings to be held virtually until the 6th of May. But there's an expectation that may well change. So we may, you know, it might not, and we may meet in person, which would be great, but it may well change. Democratic Services will let us know. Okay, and that is it, I think, for now. That's the agenda done. Thank you. Good luck for Wednesday, and do let us know, because we're
Thank
very
you.
keen to know.
Will do.
Thank you.
Good luck, everyone.
All right.
Thank
Yeah,
you.
Thanks
thanks
very
very
much.
much.
Thanks.
Thank you.
Bye.
Bye-bye.
Bye.